Hello, my name is Dr. Tanya Ghosh. I'm an eye surgeon and ophthalmologist who has specialized in taking care of diseases of the retina. I'm a retina specialist. You've probably been sent to us by your conscientious healthcare provider who cares for your diabetes and wanted to make sure that your eyes were examined thoroughly so your vision could be preserved. You may already have lots of information on how to take care of your diabetes, but I'll spend a bit of time filling in the gaps. I'll then use this time to talk about diabetic eye care, and we'll start by saying that diabetic vision loss is so very preventable. I commend you for coming to be examined for diabetic retinopathy by either me or my colleagues here in the Department of Ophthalmology and Optometry. Let me take just a few moments to talk about diabetes in general. Diabetes is essentially a blood vessel killer, an aging accelerator in good company with other conditions that do the same thing, such as high blood pressure, elevated cholesterol, smoking, lack of exercise, poor diet, and of course natural aging itself. Our understanding of diabetes in general has grown exponentially in the recent few years. Type 2 diabetes tends to stem from insulin resistance, and let me explain what is insulin resistance in very simplified terms. There is a cell and it gets fed by sugar or glucose. There are channels on each cell that allows the glucose to enter the cell to nourish it. When we eat foods heavy in fats, especially saturated fats, those fats essentially clog up the channels. So when we eat a carbohydrate such as an orange, the sugars can't enter the cell. The blood sugar then proceeds to increase as the sugar has to go somewhere, so it stays in the blood. Well, we start blaming the orange for causing the blood sugar to rise. We forgot to blame the fatty things such as beef, chicken, fish, eggs, or cheese that originally clogged up the channels. This is insulin resistance. So the best way to reverse, yes, I said reverse, insulin resistance and diabetes is to decrease, or better yet, really eliminate animal products and other fatty things and processed foods, because these fats do clog up those channels. But you replace it with whole plant foods. Foods that look like minimally processed plants, not made in a plant, staying full with lots of raw foods like salads and fruits, green leaves like kale and spinach, beans and lentils for protein, avoiding heavily processed foods. I'm impassioned about teaching about eating healthfully to stay out of the doctor's office. Now, let's get back to the eye and we'll get into talking about diabetic retinopathy. Let's start with some basic eyeball anatomy. This is the front of the eye called the cornea. The area that gives us our eye color is called the iris. Now I'm pointing to the lens of the eye. This is the area that helps focus objects. This lens starts off clear when we are born, but gets cloudy with time. We call clouding of the lens a cataract. Cataract surgery is essentially a lens replacement where we remove the lens and insert an artificial lens in its place. Here in this space lives the gooey substance called vitreous humor. The inside back of the eye is coated by a tissue called the retina. The retina receives the light signals and sends it to the brain via the optic nerve. The retina has many blood vessels, as you can see here. The center of the retina has a name, and it's called the macula. The macula is very important to us humans. The macula is what gives us our ability to see fine details such as reading and seeing the fine distinguishing features of one's face. You must have fine vision to distinguish between letters such as P and B, and also recognize each different number. Animals such as deer have excellent side or peripheral vision. We human beings, however, hold our central vision in high regard. Now let's get into what is diabetic retinopathy and how can it cause vision trouble, even ending in blindness. Presence of diabetic retinopathy tells me that you've had diabetes for at least 5 years. As mentioned before, diabetes is a blood vessel destroyer, and there are essentially two main ways that diabetes can lead to poor vision. When you have high blood sugar, the fluid in your blood vessels is essentially syrup. The purpose of blood is to take oxygen and nutrients to your cells. It can't do that well if sugary stuff is gumming up the vessels. This causes damage to the vessels such that the vessels start to leak. Well, the retina doesn't function well when there's leaking from damaged vessels. The retina is supposed to be thin and dry, not soggy. Sogginess in the center of the vision, which is called macular edema, can result in blurred reading vision. Well, this is the first way that diabetic retinopathy causes blindness. The second way for diabetic retinopathy to blind you is the following. When the blood sugars are high, the retinal vessels actually start to die. Well, the remaining cells yell out, "Hey, we need some blood." So the body starts to make new blood vessels, and this is called neovascularization, the creation of new blood vessels. Well, these new blood vessels are just not as good as the ones you were born with. They like to rip and bleed. Not only does this fill up the inside of your eyeball with blood, it can scar up the retina so it no longer works. Let's talk about how we retina specialists approach it. Let's talk about treatments. When these conditions occur, we usually start by getting a fluorescein angiogram to get a much more detailed look at the retina, more than I can see with just my own eyes. Fluorescein is a synthetic orange dye that is injected into your arm and circulates throughout the entire body, including the eye. The photographer quickly takes a series of filtered digital pictures to help us get a fully detailed look at the retina. Once you have the fluorescein in your arm, it will turn your urine bright orange for 2 days. If it accidentally gets into your skin during the injection site can hurt. In some rare cases, people can get nausea and vomiting during the procedure, which lasts about 3 minutes. There have been very rare reports of people getting shortness of breath, fainting, chest pain, and even death, but my goodness, that's really, really rare. You will, however, pee bright yellow for about 2 days. Needless to say, we avoid giving this to anyone who has already had an allergic reaction to fluorescein. In summary, this fluorescein angiogram helps us see all the details of the retina to further clarify the extent and nature of the threatening diabetic retinopathy. On the fluorescein, we're looking for dots which are called microaneurysms, which are weakened areas of blood vessels that leak. We especially look for these in the macular area. We are also looking for neovascularization, particularly in areas where the blood vessels have died off. One test that we use to assess the macular area of the eye is called an OCT, an optical coherence tomography. It's a test that looks at the cross-section of the eye, and it helps us to evaluate the thickness of the macular area. We use this to see what is the danger of fluid threatening the macular area. As we treat the eye, we look for fluid to decrease and hopefully return some vision. Now let's talk about treatment choices. There are essentially 2 treatment options in the hands of retinal specialists to prevent blindness or poor vision. They are injections into the eye and laser treatments. We use the injections to treat both the swelling in the macula also known as macular edema, and to prevent bleeding from the neovascularization. I usually start with the drug or biologic Avastin, which was actually approved for colon cancer, that pretty much every retina doc on the planet has used since it first appeared right around 2006. Since that time, there are many more drugs that have emerged. We first clean you meticulously and prevent any infections, and we numb the eye really well. Then the injection is given with a very fine needle into the white part of your eye. It takes about 2 seconds to give the injection. Are there any risks of injection? There is one major risk, which thankfully is very rare, and that is the risk of a permanently blinding infection. If a bacterium gets into the eye during the injection, it could potentially kill the eye. Thankfully, this is very rare, and we take lots of care in preparing the eye with the intention of avoiding this. After the eye injection, I ask that you not get into a hot tub or swimming pool for 24 hours. If an infection were to occur, it tends to happen about 3 or 4 days after the injection. You may feel new pain, new redness, new blurred vision, or even swelling of the eyelid. If that happens, call our office immediately. If your eye bothers you on the actual day of the injection, it may be due to the cleaning ingredients such as betadine. I recommend putting a cool compress on the eye, using lots of artificial tears, and taking a pain medicine, and the best is to take a nap. Hopefully that feeling will pass quickly. These written instructions will be handed to you later. The second treatment option is laser surgery. If there's fluid in the macular area, I will assess to see if it should be treated by injection or by laser. If it's laser, we start by putting a lens on your eye that magnifies what I need to see and hold your eyes steady. The procedure is painless and less than 10 minutes. There is the risk of hitting the center of the macular area and causing a marked decrease in reading vision, but that's very rare as your treatment is given by someone who's very experienced in laser therapy. If you see spots in your vision after laser therapy, don't worry. That usually resolves in less than a month. In the case that there's neovascularization, we then do a special type of laser surgery called pan-retinal photocoagulation, or PRP for short, which is putting laser throughout the entire retina, essentially killing the sick peripheral retina that's sending the message to make new blood vessels and preserving the central macular vision. This procedure takes about 3 separate sessions, 20 minutes each, and can cause some pain, for which you can take an oral pain medication in advance of the procedure. PRP does cause some reduction in peripheral vision, some loss of color vision, some loss of night vision, and can cause some glare. We, however, do PRP to preserve central vision and not let the eye get flooded by blood from neovascularization. There is a third treatment, and that is taking the patient to the operating room to repair the retina. If there's too much blood in the eye that's not clearing, or there is scar tissue that has developed from the diabetic retinopathy that is not allowing for good vision, we do go to the operating room to clean that up. Needless to say, that is something we'd like to avoid, but that option certainly is there in very advanced cases of diabetic retinopathy. Well, this was a lot of information, a bit of an overload, but please don't worry. We will discuss this in person and allow plenty of time for questions so you feel comfortable. Do remember the importance of eating healthfully and exercising, some body movement of your choice to strengthen your blood vessels. These measures have been shown to reverse diabetic retinopathy when done conscientiously. That power is in your hands. Thank you so much for your attention. Your doctor will be in soon to do a comprehensive exam on you.